All right, welcome back. We have an exciting afternoon planned, so I'd like to welcome Dr. Kumar to give an update on accomplishments from the state's previous two-year action plan and to share proposed priorities for the next two-year action plan. Then Dr. Glassman will, who is the chair of the California Partnership for Oral Health Steering Committee and the Associate Dean of Research and Community Engagement at the College of Dental Medicine at California North State University, will share how the California Partnership for Oral Health works together to advance the state oral health plan. Then we'll go over the seven proposed priorities and discuss activities that can move those forward at our tables in an interactive way. So instructions coming for that. So welcome, Dr. Kumar. Thanks.
Thank you. So this is very interactive session. This is working session, so no more speeches, okay? So quickly, so we are halfway through our plan. This is a 10-year plan, and we are in year 2023, and exactly halfway through. So the plan had 5 goals, and we decided to focus on only certain objectives and activities, strategies and activities. That's how the plan is written. So I'm going to go over and give you some reports. The way we did this progress report, Dr. Lynn Walton Haynes and I, we sat together, we went over all the goals, activities, and strategies and counted, tallied basically, whether we have implemented, not implemented. So very simple. Oops. Okay, so we want to call it as 2-year action plan. And so this is how we implemented. The first part is there are certain goals and activities that CDPH and DHCS decided to undertake. And then the California Partnership was involved in identifying some priority strategies. We developed a 2-year action plan. So 18, 20, and then COVID hit. Not much happened. So we had work groups to develop action plans and monitor progress. At the local level, we had a grant program, 5-year grant program, and now we are in the second iteration of that plan. Okay. So goal 1. So goal 1 was all about community level interventions promoting healthy habits. So out of the 4 objectives, 3 we implemented. That doesn't mean we completed. We just started the activities to implement. Okay, that's how you should interpret it. There were 3 strategies, and we addressed all 3 of them. And the goal and activities, out of 16, we implemented 9 of them. Okay, some of the activities, we provided grant support for community water fluoridation in San Jose. We have, you're all familiar with school-based linked program grants. And also we supported tobacco cessation counseling. And on the Medi-Cal side, it's a reimbursable benefit now. Okay, goal 2. This is about individual level interventions. Okay, that was community level, and this is more about individual level. So out of 9 objectives, we addressed 7 out of 9 strategies. We implemented 6 of them, and there were a lot of activities, and we supported 28 of them. Now, most of these initiatives are, as I said, relate to individual level interventions. So the Medi-Cal dental program was the lead, and you can see the investment on different initiatives. These are huge. Okay, dental transformation initiative was $750 million. So I think Alcala can agree with me. I think we doubled or even increased the medical budget in the last 5 years, right? More than double. Okay, goal 3 was about developing the infrastructure and capacity. This is where the local oral health programs fall. So as you can see, there were we addressed 4 objectives, 4 strategies, and 5 activities. So out of the many activities, so you can see we haven't undertaken, we have not addressed many of these activities. Okay. So our framework for a local oral health program was basically to develop a plan and implement interventions at the local level and evaluate. So we had first steps and the next steps: inform and educate, convene, coordinate, collaborate, implement policies and programs, and conduct surveillance and evaluation. So that was part of the local oral health program grant. Okay. So communications. So there were 4 objectives. We addressed all 4 of them, 4 strategies. We addressed all 4. Out of 21 activities, we implemented 12 of them. So some examples: promote oral health literacy. So we developed a toolkit in collaboration with UC Berkeley and with UCSF Technical Assistance Center to create this environmental in dental offices to communicate more effectively using plain language and using teach-back methods. So that's the directed towards professionals. So the other one was public facing. That's the medical dental program Smile California campaign. And the other thing, we told all local health departments to create a very nice website. And I'm using Orange County as an example. I think this was the first one they invested on developing a website. So we want all local oral programs. They are in different stages. And this one has all the information about oral health, how to take care of the teeth, how to find a dentist, and how to pay for dental care, low-cost dental care. So all that information is easily accessible. So we know one of the problems people face is accessing this information, especially if it is, it requires internet connection. Not everyone has this kind of internet connection to access the information. So we know that as a barrier. Hopefully, federal government will address that. And Smile California. So this information, to me, I think this is one of the best in the country. There's a lot of information if one wants to access it. So last one is surveillance and evaluation. So we addressed all the goals, strategies, and activities under this plan. So we are moving towards evaluation and performance management. So we'll be talking more about that. Now, so we published a plan. We conducted the California Smile Survey, and we created this performance management system to track how well we are doing, how much we are doing, and what kind of impact it has. So we provided training, we had lunch and learn sessions. And so I'm going to stop here. Any questions? Okay, I did so well, Lindsay. So should I move on to the next one? Okay, all right. So this is what we hope to accomplish this afternoon. Start working on this next 2-year action plan, 24 and 25. We know that it will not be completed, today, but we want your input. Okay, so in objective 1, we addressed all 4 objectives. Same with objectives 2. The first 5 we addressed, and here are some not addressed. There are opportunities. So diabetes, it's a major chronic disease, and there is bidirectional association. In other words, diabetes leads to periodontal disease, gum infection, and that can increase the demand for insulin and worsen diabetes or glycemic control. The other one is about emergency room visits. So there are a lot of, we have given you data about your emergency room visits. We can save a lot of money if we prevent these dental visits for emergency. You know, among somewhere I looked up for children under the age of 1, there are about 1,500 visits or so, just because of teething problems. So the next one is about institutionalized adults. Simple toothbrushing can make a huge impact on pneumonia cases. So there are some protocols and some hospitals, it's mandated now. So we can make a big difference there. And another one is under Objective 3 about community health work, how to leverage community health worker benefits. It's a benefit now in California. It's about health education and health navigation. So how do we leverage that benefit? The other one is increasing the number of payers that implement dental benefit policies and payment strategies to support community clinical linkage models. So school-based program is a very good example. Similarly, it can be done for most of the chronic diseases. So how do we implement some of these and support some of these community clinical linkage models? Okay, capacity of FQHCs. I know CPCA has been leading this effort, encouraging FQHCs to expand capacity and include dental wherever possible. That's another area. There are some opportunities, and I know Senator Bernie Sanders is always interested in expanding the capacity of FQHCs, and he always talks about dental. So if you listen to Bernie Sanders. So that, okay. Yep, I'm going to stop here. My time is up. Right? Okay.